Hello, good morning everyone. This is Dr. Manish Mahajan, consultant neurologist from Gurgaon again. So, a very good morning. So this morning, continuing the discussion and learning about multiple sclerosis, we have discussed till now that multiple sclerosis is a brain disorder. It affects brain, spinal cord, optic nerves. The common symptoms: optic neuritis, weakness, imbalance, tremors, then bladder symptoms. We also discussed how we usually diagnose multiple sclerosis by ruling out other mimics and with the use of MRI, spinal fluid examination, specialized blood tests. Now, continuing the discussion further, I would like to discuss the treatment modalities. So when it comes to treatment of multiple sclerosis, we usually divide it into three parts. That means one is for the acute attack. Now here I want to mention that before we start discussing about treatment of multiple sclerosis, the discussion till now has happened about a very important type of multiple sclerosis, that is the relapsing remitting multiple sclerosis, RRMS, because it's the most common variant. 85% of the people usually get it, and it's the one which starts at between the age group of 20 to 40. Now, after 1 decade or so, maybe 1 to 2 decades, most of the people, from 50 to 80% of the people with RRMS, will progress to a phase where the disability acquired because of the relapses will shift to disability despite no relapses. So that is what we call as disability progression independent of relapse activity, PIRA. Now, here the disability progression happens slowly but relentlessly in the absence of relapses. So this is the secondary progressive phase of multiple sclerosis, and what we call as SPMS, secondary progressive multiple sclerosis. There is another type of multiple sclerosis, that is a primary progressive multiple sclerosis, or PPMS. So here the progression happens from the outset, and when someone gets an attack, these people can also get some attacks, but the most important thing is that the disability progression, and it's a continuum independently happening of the relapse activity or MRI or a clinical activity. So I have discussed already what defines attack. Now, if we talk about treatment, then as I discussed just now, that it is threefold. One is the treatment of the acute attack or a relapse, which, just to reiterate, it is any new sign or symptom which stays there for 24 hours, and it should be something which should be new and should be having a gap from a previous new symptom of at least 1 month. Now, how do we treat a relapse? Or depending upon the severity, we usually treat it with IV methylprednisolone pulse therapy from 3 to 5 days. I told earlier also that relapses can improve without steroids also, but it has been found in few studies that not only steroids help you expedite this recovery, but also improve the extent of recovery. Now, the recovery from an attack can usually be a partial or a complete recovery, but for every clinical relapse, what has been observed that there is almost 10 new lesions which come up on routine MRI scanning also. So there are certain silent clinical attacks which are going on. So that is something which we are always concerned. So there are something which we call as surveillance MRI. So the difference in the treatment of multiple sclerosis is that not only we treat the acute attacks, the most important pillar of multiple sclerosis treatment is what we call as the disease modifying therapies, because here we are supposed to prevent and to suppress that disease specific inflammation which is actually causing the damage to the nerve cells, their outer coverings, and causing relapses or any MRI activity. So once we diagnose multiple sclerosis, the first and foremost is a dialogue between the treating neurologist or the MS physician and the patient or person with MS. It's a basket technique which we use, but most importantly, the defining or the characteristic which is used in the decision making is the disease activity. So that is something which is the most important. Otherwise, there are a number of other patient factors and the disease factors. Now, patient factors most importantly is the age and gender, because MS is more common in females up to the tune of 3 times more than males. So, and it affects the younger age group. So we have to take into account the reproductive health and the potential of problems of DMTs affecting the pregnancy as well as the baby. We'll discuss it later on in detail. Now, the third aspect of treatment is obviously the symptomatic treatment. That is, whatever symptoms have happened, you treat them. Like, we can offer treatment for spasticity, we can offer treatment for tonic spasms, we can offer treatment for pains. There are medical managements for the fatigue. Another less often talked about modality is regular exercise and rehabilitation, physical rehabilitation, and obviously occupational therapy. They have a major role in the restoration of the function. So disability prevention is the key basis for the treatment of multiple sclerosis. Now we will discuss all of these treatment modalities one by one in the coming days. So goodbye for now. Have a nice day. That's 4th May 2022. Thanks for listening. Follow, like and share. Thank you.